Time is everything after someone suffers a stroke. Now a new technique at the University of Rochester Medical Center is allowing stroke patients who don't get to the hospital as soon the same full recovery. 13 Wham's Jen Markham tells us how this minimally invasive procedure saved the life of a Webster woman.
5% better. I can walk, I can talk.
Earlier this year, while watching the Super Bowl, 42-year-old Christine Skolnick of Webster didn't realize the upset stomach and headache she felt late in the morning was actually a stroke until the early evening.
When I tried to call my husband to say, can you come up, and I couldn't speak well. And it's like, and then I tried to stand up and I was staggering. That was the case of something is majorly wrong here.
By the time she arrived at Strong Memorial Hospital, 8 hours had passed since the onset of the stroke. Too late to receive drugs that could have dissolved the blood clot in the major artery leading to her brain. But doctors presented Christine with a new option called an endovascular thrombotomy, where doctors threaded a catheter into the blocked artery, injected an anti-clot drug, and then actually suctioned out the blockage.
When you pull it out of the catheter, you can actually set it on your tray and see how big it is. So we have a very physical proof, graphic proof that we've removed the blood clot with that device.
The procedure was done while Christine was conscious, and she says removing the clot allowed her to make a full recovery.
Once it was out, it was, not instantaneous. I can move and talk, but the pressure was gone, and I'd say within minutes I could talk somewhat.
Doctors are hoping this new technique will not only extend the treatment window for stroke patients, but also allow clots to be treated quicker than with traditional drug therapies. Jen Markham, 13 Wham News.
Doctors say the new technique gives patients about a 60% chance of a full recovery, whereas traditional drug therapy provides only around a 50% chance.
Coming up is airline passenger satisfaction.